would like to welcome Dr. Morarji Peesay on behalf of all of you towards today's seminar on diagnostics and innovations in the field of neonatal medicine. To introduce briefly about Dr. Morarji, please keep quiet. In various hospitals in the neonatal department. In the pediatrics ward, he made so many innovations. Like a scientist, he developed so many apps. Usually it's not very common for the doctors to go into developing scientific applications. You can see in the Google Play Store search apps and so many books for the PG medicine, like textbooks for the preparation in the Amazon. It was amazing, sir. So last 3 weeks of learning about your innovations and the simplicity of the innovations. Innovations, research, scientific discovery means we always think about very big things, but sir worked with so many small applications and made very useful applications. It's very important, right? So with limited resources, he has done extremely useful innovations. Thank you very much, sir. We are very happy to be part of your future journey, and we would like to work with you on all the aspects, various aspects to develop. And today, Professor Ratnagiri sir wanted to deliver a message personally here. He conveyed to me to speak to all of you. And today we have two more guests again through Professor Ratnagiri sir. I would like to welcome them also to MNR. Dr. Paresh and Dr. Vasundhara from National Institute of Animal Biotechnology. Now I would like to request our VC sir to formally invite them to our campus. Sir, please.
A very good afternoon to Dr. Morarji, Dr. Paresh and Dr. Vasundhara and all the faculty members and students. It's another a very happy occasion to invite Dr. Morarji, a very eminent doctor and a scientist both. And there is a purpose in inviting him here. He was being introduced by Dr. Ratnagiri. I think all of you, most of you may be knowing Dr. Ratnagiri. He is coming to our campus for the last almost 5 to 6 years on a regular basis, and he has been very instrumental in guiding our staff and students towards research and towards establishment of our central research laboratory, and in fact appointment of Dr. Vishwanath, Dr. Hema for the central research laboratory. All these things, there was very good role of Dr. Giri in doing all these things, and under his guidance only we have taken up the research activities in the campus. And he has recommended to invite Dr. Morarji to our campus because he is not only a doctor, he is actually from Kurnool Medical College. He has done his MBBS from Kurnool Medical College way back in 1974, I suppose. 77. He joined MBBS, and maybe 4 years or 5 years later he might have completed his MBBS, and he has done his pediatric course, and he is settled in US for the last almost 25 years. He is in US in practice. At the same time, not only like doing general practice morning till evening, taking care of the patients in the clinic and other things, but he has also done something beyond. That is, he has taken up some tasks which can help the humanity and which can with simple ideas which can bring some benefit to the patients and humanity at large. So that's how he has brought up certain devices, certain apps. Can you name any doctor who has built an app in the Google App Store or anywhere? No, we don't know anybody. He is the man. We have seen. So that means, what is the idea in bringing here? That is, doctors need not always think about their practice. No, they can think beyond something, beyond that also. That is, they can also think towards innovation. They can also think towards doing better things than routine doctors do. And why the country like US and other things are far ahead in research, and why they are, everything we copy from there. All the gadgets, equipments, medicines, everything we copy from US. How many we are producing indigenously ourselves is very marginal, maybe less than 0.1%, less than that. All the gadgets, till now, whether we name it any gadget, whether it is endoscopy or colonoscopy or any such gadget, even robotic surgeries, everything we import technology from other countries. The main problem is we never are exposed towards research, we never are exposed towards thinking beyond what is taught in the classroom. So, with that idea, we have invited Dr. Morarji, and I am very glad that he has accepted our invitation. And yesterday night only he landed in India. So you can see the time gap between US and India, 12 hours. So this is the time for them to happily sleep at home. So instead of sleeping at home, he has come all the way to our campus, and he was little, I could make it from his face that he is having that jet lag, but still he is very enthusiastic and very interested to take part and talk to you people. And it all depends on you, how you take it. It's really a wonderful thing when such people come here and they are bringing in certain new ideas. They are allowing us to think in a new direction. And our mind also starts thinking in the direction, so that we will be, whether how many of you become scientists tomorrow, that we can't say, but at least one among you, if you become a scientist, this program will be a grand success. There is no doubt about it. If one of you become a scientist, because we can't expect all of you to become scientists. So this is one such initiative taken by us to guide you in that path of research. Hope this session will be a very good enlightening one for all of you. I once again wholeheartedly thank Dr. Morarji for coming here and participating with us. Thank you.
You can see nowadays in the campus we have so many activities on the guidelines of the management's view what sir just expressed. I would like to announce for a minute about the small activities we are doing from the research center. We have one program like every second Saturday evening, faculty or students who want to write a project, own your project. Means you can come and be with us for 3 hours, 4 hours, and we will help you in designing the project. And last week there were 3 faculty members from Biochemistry Department of Medical College came. They wanted to have diagnostic applications for certain local diseases. So we have helped them how to design the PCR reactions, design the PCR primers, how to amplify certain genes. So it is like a class for you, tailor-made for you. Whatever you want to do, according to that we can have the discussion, and that will be your project. We will help you in doing those things. With this, I would like to request Dr. Morarji to take the dance, please.
Well, thank you. I'm grateful to be here, and there's a lot to talk about the innovation. That's why I'm here. And my biological clock is yo-yo. I'm supposed to be sleeping, but hopefully I got caffeinated, so I will be awake. So with that, I just want to start you to say that you need to stay, I'm going to stand here, you need to stay hungry and foolish. Just like this baby who wants more bottles, hungry, and then the baby says, keep coming. So the kids are really creative. The kids are, if you talk to them, they have no freedom of any, they don't have a restriction of any rules and regulations. And it's a very important to, I think we have a tendency to kids to reject their free ideas. I think if you respect them, listen to them, then they come up with fantastic ideas. So we need to respect that. Do you know who said this? Who said this? Stay hungry, stay foolish. That is very important. That's the message I want to hone it down. You don't have to be an academic person. You don't have to be professional. You don't have to master degrees. To be creative, you have to be childish and free yourself from the rules. So, and then you need to have a passion. Passion is the one that guides you all the way. So that's who I am. I'm the faculty of Georgetown University Hospital, Washington, D.C. And like I've been there for almost 23 years. My daughter is 21 years old now. That's a big milestone for me. So all I do is neonatology. And what happens is if you're there in some specialty for a long time, there's so much you can do, and you start getting bored. You need to do something more than that. So then, this is the start of spill out from. So, and then I moved to R&D Institutes. My degree is Dr. Morarji Peesay. Does anybody know Dr. Morarji Peesay, neonatologist? So he's retired. He's there in R&D Institute. He's one of the big person in neonatology. Then I moved to England. I was in everywhere. I was in Leeds, I was in St. James's University, Hammersmith and Glasgow. And then there was one Pakistani person said, what are you doing here? You should go to US. Because US has a lot of, it's a land of opportunity for physicians. That was in 1984. I said, okay. So I'm there in US and I settled there. So basically I'm a local person here. So the agenda is, it's a long agenda. I'm going to talk to you about innovation economy. Innovation economy in US and globally, how it is. I'll give you a big picture. And diversity and innovation, this is a very interesting concept. The more women that you have, and what is the impact of that? There is diversity is a bigger concept than gender, so I'll touch base with that. And then I'll talk about my innovations and collaboration. Collaboration is the key now. Everybody is really trying to collaborate. They are trying to speed up this collaboration. And there in between those topics, I'm going to throw you some creativity techniques. There are some techniques. It's like a muscle. Creativity is like a muscle. The more you exercise, the more it gets strengthened. Anybody can do that. I'll show you the tricks that you want to do. And then the gap between basic science and the clinician is really widening. Basic science knowledge is this high. And the clinician is way down here. You know why? Because the basic science growth is exponential. I'll talk about that. The bridging the gap of that is very important. And then I'll propose some research aspect. Is there any neonatologists here or pediatricians here? Or who want to become a pediatrician? So that will be useful for you. So, and the innovative educational materials. Google syndrome, you heard about. A lot of parents, a lot of people, patients read about so much of Google, in the Google about their diseases. They come and challenge you. And then that's what we call this Google syndrome. They come with that. So you need to be, you need to have a quality of information. You need to have an innovative educational material. So hopefully you have a high dose of coffee because this is going to be a long lecture. Okay, I have a loading dose of coffee and it's very interesting. I don't know if you know or not, we give IV caffeine, intravenous caffeine to the premature babies. Did you hear about it? Anyone heard about that? So we give IV caffeine to the babies because it helps babies to breathe. And that has really done a fantastic job. Every drug has a side effect. Some of the drugs have a good side effect. What happened was when we gave this caffeine to the babies and looked through retrospective study, some of this significant number of these babies had reduction in cerebral palsy. Caffeine is neuroprotective. And this is a big deal now. Everybody is using caffeine as a neuroprotective. It's useful in Alzheimer's too. And there was a very recent data about a few months ago, the New England Journal is a large retrospective study. Those who drink coffee 4 cups a day, their lifespan increases by 18%. So, if you are not drinking coffee, but the good news is that it works even on decaf. A lot of people don't drink coffee because it causes tachycardia, right? But it works in decaf. Coffee has like 1,200 chemicals. That's why when you make coffee and you leave it on the table after an hour, you can't drink. The taste goes away because these 1,200 chemicals denature and loses the taste. So I can talk about coffee for a long time, but I'm going to skip that. So make sure you have a loading dose of coffee. Very interesting fact, the innovation economy in the US is broken. It's a very, it's a sad news for the US. And entrepreneurial activity is 30 years low in US. And I can see that. That's why I'm here for collaboration with a lot of people here. And Asia is really catching up with this one. And more businesses are dying than starting in US. This is another startling data. And why part of the reason is that in US, people want to dump, they have a lot of money. People want to dump billions of dollars into fashionable innovations. I don't know if you've seen this juice mixture, which is $400. And of course it didn't fly, no one can buy it, and it goes away. So the way they're spending money is, I'll talk more about that. There's a problem how US is tackling this. And this is one of the reasons, the wealthy sliver of the population, they are focusing on that because they think that the money can come much faster. So there's a skewed way of how they're looking at this system. Quantity breeds the quality. That's a very interesting concept. We have like more than 1 billion population. And in the US and Western countries, they say, oh my God, these Indians are smart, they're nerdy, they're good, they're so smart. That is because if you have a 1 billion population quantity, you bring the quality. The quality comes out. That's why a lot of smart people are coming in. And very interestingly, the incidence of genius globally is same. The incidence of genius is same. The reason why we're getting a lot of smart people brain draining is that the quantity breeds the quality. The same thing is true in innovation. The more ideas you have, the better it is to get a fantastic idea come out to the market. So you need to have a quantity of ideas. That's one of the take-home messages for you. And the good news is that there is a global innovation index. In the global innovation index, here we go. So in the global innovation index, they score all countries who is doing, what is the innovation, how much that country is doing. India has done better. In last 2015, it has jumped from 81% to 66th rank. I think India is doing a fantastic job for a reason. There are reasons for it. And the better performance index shows that there's strength in tertiary education, software exports, corporation research and development, and there is a market sophistication. So India has really shifted its trend and attitude, the way how we look at the situation. And this is a global innovation index. You can see US has gone down. Switzerland, Sweden, they're really on the top of the list. Here, if you see BRICS countries, after China, India has come up from the Brazil. So I think India has a reason to believe that. You can actually feel that this is happening. And just like AOL, America Online founder said, America was actually by itself once a startup company. 250 years ago, people went there. It's a startup company, and that has throughout the American history, going back from Ben Franklin and Mark Zuckerberg, they did a fantastic vision. They had a big vision. They made it materialize. Mark Zuckerberg is still the person who is doing Facebook. So it is the message is that innovation is a highly relationship driven. That's important. It's not a one-man job. It's a relationship driven. Very interesting thing is happening in India. Why the entrepreneurship is low? Because there's a lot of money there, like 25 venture capitalists sitting there with a lot of money in the big cities. They are in New York, they're in San Francisco, and they are everywhere. The data has shown that those big venture capitalists, they don't want to venture beyond that state. They don't want to venture to the strangers. They want to give their capitalist money to the person who knows. So there is some problem US is facing. Now we are trying to realize where exactly is the problem. One of the problem is the venture capitalists are highly concentrated in certain areas. And because of that, most of the innovations that truly matter, they don't see the light of the day. Most of the good innovations seems to fizzle away, go out of. Only a handful of people in the big cities seem to decide which entrepreneurial person gets a shot. So there's a problem the US is facing, and the solution is really welcome to the innovation ecosystem. It's a teamwork, it's a group, it's a package. You need to have an idea with a package. And you need to develop that. Don't think that your idea is going to be stolen. That's not going to happen. Don't keep the idea to yourself, and then eventually you see someone has already made it. You need to release to your friends, expose and talk and discuss, and that's the only way. I'm going to talk a little more about that. So the world in which the success of value proposition depends creating alignment of partners. You need to focus on this ecosystem. So if you're not doing that, then that's going to be a problem. But the good news is that this is a avoidable failure. So we can really solve this problem. So if you have a big problems, you have a water problem, you have pollution in Delhi, I just been there, and innovate. That's the only way. The middle part of the Indian population is fantastic. You guys are young, you guys are energetic. You don't need education, you don't need academic. You should have the attitude to innovate, how to solve problems, how to come up with the creative ideas. Don't look for one creative idea, don't look for one or two. Go for hundreds of ideas, bring them up, and then you'll see the solution. That's what the Africa is realizing. Finally, the best way to solve a big problem is to innovate. That's the only way. So this is the study, like I told you, innovation and diversity. So one of the ways of that you can bring the innovation is bring the diversity. This was a study done in Munich, Germany. They did on 171 countries. I think that they are inviting almost 1,600 countries. What they did was, the study, they did two questions they asked. Number one, how much innovation the company is doing. Number two, how diverse is this company. And when they asked the question, it was very clear. The more diverse the company was, more innovations. This research of 171 countries has clearly shown you need to diversity. Some companies, we started doing that. How? We have one woman in our company. That's not enough. You need to have a very significant number of population. This is the graph that shows the innovation revenue really goes up if you have diversity. This is a very good data that's coming up, and this is the one. Innovation jumps once the proportion of female managers rise 20%. It's not enough to have one. If you have 100 people, you need to have at least 20. You need to have a significant proportion to make a difference. So, and it's not limited to diversity. Gender. It's more than gender. It's a career path. Different career path people should be there. Different country of origin and different industry background. Very interestingly, academic background does not contribute. Does not contribute for innovation. Age does not contribute. So this is a very important data that has come out. So diversity, you have seen those who are at least in Europe and the US, those who have a different biracial family, biracial kids, they are very handsome, very beautiful. So the diversity is telling you, Obama, look at him. He is such a smart guy. So something happens. When you do diversify, something great happens. You have to invite the diversity. There is a money there. There is an innovation there sitting to happen. We do diversity every time. The pizza comes here. Indian pizza. It's like not Italian pizza, it's Indian modified pizza. So you have, it's like you have Indian food in the US. It's a modified, Americanized US. It's a very, last time when I went to Paris, I ate pizza. Pizza is from Italy. The eating pizza in Paris was more tastier than actual in Rome. So you can see the diversity triggers, spurs, newer type of innovation. So you need to invite the diversity of language, diversity of ethnicity, religion, and nationality. It makes a huge difference. It's good economically. It makes sense. So let me list out my projects. And before that, let me tell you, this is everybody knows, necessity is the mother of invention. We all know this is the, we've been taught time. But I think the take-home message is you reverse that sentence. Reversing that sentence, invent and create a necessity. You invent and then look for necessity. Oh, this is not useful, don't do that. Because Steve Jobs, when the iPhone was not there, he had a vision, he knows. He said, I'm going to invent this and create a necessity. Now he can't live without it. He can't imagine without this smartphone. So, a lot of people, when computer didn't come up, it was a thing, it was a vision. The person who said, I'm going to invent this and create a necessity. It's fun too. It's fun to be creative and it gives a benefit to yourself and other people. So, you can invent just for the sake of fun and create a necessity. That's also one way of looking at it. There's a long list of things that I have, and hopefully I'll have time to go through some of them. I told you bridging the gap between the basic science people, physiology, anatomy, biochemistry, and nanotechnology. All those people in the basic science are sitting there with tremendous amount of knowledge. And the clinician, we have a problem. We don't know how much good they are doing, how much knowledge they have. If you bridge the gap, that will spin off a lot of innovation. So collaboration really is a very important terminology. A lot of institutions, a lot of countries, inter-institutions, they are catching up with the collaboration, and it's growing much faster in other countries than US. There's a collaboration problem in US that we are facing. In the past, to say you have to be expertise in certain aspects that seems to actually killing the innovation in the workplace. You don't have to be expert to be innovative. You don't have to be neonatologist to create a, if you look at the Steve Jobs, there are college drops. And he created the product. There is, no one can, none of the experts and the academic people would have done that. So you don't think that you're not qualified to innovate of any specialty product. Don't think that, you have to have that attitude. That will be very useful for you. So there are two types of collaboration. Vertical collaboration, horizontal. Vertical collaboration is like, I'm a neonatologist. I work in my specialty is in the lung, neonatal lung problems, and I go to a specialist in Germany who is expert on the same thing, and I collaborate. That's a vertical specific specialty collaboration. Horizontal collaboration is much broader ways of collaborating. Why does collaboration work? Because it does work because of the different cultures. Different institutions have different cultures. Different nations have different cultures. And different belief systems they have. The Department of Physiology here is different than US Department of Physiology. They have a different belief system. That seems to spur the innovation and ideas. So there is a reason why diversity works. There's a basis for it. From my Georgetown University, we have like 400 scientists sitting there and 300 active clinical trials. There's a lot of $110 million that they are spending on the research now. is extremely diversified, and they are focusing on, I was talking to the dean of the vice dean of the hospital. I said, we need to bridge this gap. I said, let me do a project here. I said, I'll go to, as a clinician, I will go to all the labs, and about 10 to 15 labs, and just to visit them and talk to them personally, sit down, and then conversate, share the interest, and see what happens. So I went there to Olmsted, Dr. Olmsted. He's a theorist, he's a simulator, he's a physics person. Nothing to do with the neonatology. I said, well, I'm going to go there. I sat down with him, I talked to him about my research, what I'm doing, and he shared his research. He said, oh wow, you're working on a protein. Why don't you go to Stanford in California? Because he's doing the same protein. This is his phone number, you call him. So I called him, now I have a project now. Just because I visited this person, I talked to him. So collaboration really works. Then I went to Dr. Paranjabay's lab. He's also a physicist. He's like a nanotechnology person. And he was working on the same project that I'm working. And guess what happened? I gave a lecture, just like this kind of a lecture on the research that I was doing to physics group of people. How many times do you see a neonatologist talking to the physics group of people? So this is very interesting. So the bridging the gap from the basic science definitely works. I went to Brent Harris, he's a pathologist, neuropathologist, and I just talked to him. He took me around his lab, and I introduced to him, and we discussed. Now we are coming up with a research paper. As a neuropathologist, I'm doing animal brain study. I'm looking into how the brain differs from a nuchal cord. I'll talk to you about molecular cord issues that I'm working on. And I have a project. So I think the collaboration really works. Rahul Saxena, biochemist, I'm actually, with patent, we came up with a product, we applied for a patent. This is how it happened because I just decided, okay, I'm a clinician, let me go and visit the lab and talk to them personally, sit down, and then share the... So I came up with the idea that I told my vice dean of the Georgetown that we need to have a clinical basics collaborative research, a global platform. You need to have a basic science and a clinician on one web page, and bring their it should be dynamic facilitation on the web page, and bring their listing of the research what they have done, instruments that they have, clinician what they are doing, and they should be able to collaborate, make an appointment, and talk to each other personally or use the media. Have a schedule a visit. It all can be done on a website. Have a forum from basic science and clinicians, chat box, and annual forum meeting. So I think this is like a lab scientist, a basic science person can visit to the clinical side and learn from them. Vice versa, if you visit on both sides, we learn both. So that is the one side of the innovation. Collaboration works, diversity works. So you have these are very simple techniques that you can shift and then be foolish. To be creative, you have to do stupid things, silly things, and people will laugh at you. Don't worry about it. Keep them to yourself, start working on it, and you'll be amazed how things will change. So let me switch the gears. The cost of innovation is also important. It's a hindrance for many people. You have an idea and say, oh my God, this is going to cost a lot of money, so I'm going to back out. But there are no cost innovations that really revolutionize. And there's a low cost and high cost innovations that are, for example, here, surfactant replacement therapy. This is a liquid that is lavaged from the animal lungs. You just wash them out, take that surfactant liquid and give that to the babies, premature babies who have a surfactant protein deficiency. By giving that, it has revolutionized and it has reduced the number of deaths in the babies. And this is a high cost innovation. Each 3 ml costs 20,000 rupees. In India, it's like $200 or $400 in US. But the survival of the premature babies is amazing. It just shifted the whole thing. On the contrary, this is a no-cost innovation. What is no-cost innovation here is, I'm sure you heard about sudden infant death syndrome. Some babies who are 3 months old, they just die. Have you heard about it? Some babies, they just die, they know reason. That's called SIDS, sudden infant death syndrome. Nobody knows why. The solution for that was back to sleep. Very interesting solution. That means when a newborn is, don't keep the baby face down on the bed. Keep the baby always back to sleep. Back should be supported. By doing that simple technique, and it didn't cost anything, as the awareness of that procedure went up, number of deaths of the babies came down. Dramatic reduction by simple, no-cost innovation. So someone kept on thinking that let's do that, and they applied intensely, they advertised, they raised the awareness of the parents, and it changed. It's a no-cost innovation. And so what happened was, when you combine these two, no-cost and high-cost innovation, in the US, the number of infant deaths reduced by 40%, almost half. Dramatic change by the innovation. You can make a change in people's life by these innovations. So this is a low-cost innovation, and this is the Dr. Govind Rao. I met him just before coming 2-3 weeks ago. I visited his lab, again because I know there's a lot to gain by visiting, by talking person to person. And he's doing the cardboard incubator. Now this is the cardboard incubator. It costs like $20, but actual incubators for the premature babies are like $3,000, $4,000, or $10,000, depending on the sophistication. He made this one with the cardboard, and he's applied for a patent. He's going to sell off. He's going to let the patent go away so that globally it is applicable. So this is a low-cost innovation. It really works, and this is another low-cost innovation. Rahul, what's his name? Narayan. Yeah, this is he did this hypothermia alert system. You use this, it's a wristwatch, you put it on the baby's arm, if the baby's temperature goes down, it alarms. So this is a low-cost innovation, a simple device, and globally it can change now he got like $2 million. Gates Foundation, very recently he was awarded Gates Foundation funding for further studies. This is again low-cost innovation. Another low-cost innovation that they use. So let me ask you a question. How many of you claim yourself to be creative? Raise your hand. See, that's surprising. Exactly. So I see only few hands. Everybody, every day is creative. Remember that. Everybody, every day is a creative person. You create your day. You don't realize that. You don't give importance to that. We are born creative people. Once you realize that you are a creative person, that's a freedom that you can get with any money. So change your attitude. Everybody is a creative person. You don't have to be expertise in your class, with your grades. It has nothing to do with the grades. If you see all those big scientists who have done humongous revolutionary discoveries, they were bad when they were students. They were stupids. That stupidity gave them a chance to free themselves on a discourse. So the inventory is fun, and you just have to cultivate the out of the box. A lot of people say out of the box. You need to think out of the box. Don't think routinely. Come out of it and do things. I think that terminology really works. When you're brainstorming a problem, family problem, personal problem, or academic problem, any problem, once you become aware that you need to go out of the box, just that itself triggers you and gives you a lot of problems. Like I told you, the kids are very innovative. And you may not know, this baby said, my plan is to start crying at 3 a.m. for no reason. Now, I'm not sure whether they really think, but I think they are smart. They know what they are doing. If you see the newborn babies of 1 or 2 months old, they manipulate parents a lot. No, they are very smart babies, I'm telling you. I have seen them for 20 in the neonatal intensive care unit. They can manipulate parents. So Edward de Bono says there are 2 types of thinking, vertical thinking and lateral thinking. Vertical thinking, what happens is, like, you know how to cook this rice, you know how to cook this, some particular spicy food, there is a strict guidance. Or you know how to use this respirator, ventilator, how you use it. There is a strict policy and protocol, you use that. That's vertical thinking. And vertical thinking is really important. It's essential for life, vertical thinking. Lateral thinking is a creative thinking. Lateral thinking is like a mutation. Lateral thinking will take you, you're on first floor, it takes you 10th floor right away. So lateral thinking really spins off creativity. You need to have a lateral thinking, you need to develop that habit, breaking away from existing patterns. You know, this is the way you pass the endotracheal tube to the baby. This is the way you give IV to the baby. Just challenge the routine. This is the way you eat. Challenge the routine and say, this is wrong. Just say it's wrong. Then something interesting happens. When you challenge the routine, then the out-of-the-box thoughts coming up. Just for fun's sake, just say, this is the routine, this is the way you would walk. No, that's wrong. Just say wrong. It's wrong, and then start thinking, what is the alternatives? So those are the simple techniques that you need to come up with. This is the take-home innovation technique for you. Random words. If you pick a word, actually there's a website called randomwordgenerator.com. You go there, pick that word. Those words are very rich, imaginative words. And those words, principles of those words, if you apply those principles of words to your problem, amazing things happen. So you have to learn how to use that. I'll give you a lot of examples for that one. But you know, nature has a fantastic processes. For example, here you can see cockleburs, the thing that sticks to the clothes, right? Well, I don't know what you call in Telugu, I forgot about that. So, George Mestrel, he used that concept and he created the Velcro. You know Velcro, right? The Velcro that you can apply for a zip and take it out. So he invented a simple Velcro by looking at the nature processes. So there is a lot of things that you can learn from the nature. Okay, let me come back. Let me come to my innovation. This is the high frequency nasal cannula. This is it's not a real baby. We put a nasal cannula. This is in a high frequency vibrations go through. That is where the oxygen and the air goes through, and it vibrates the lung. And the vibration lung seems to be a gentler way of giving oxygenation or giving. It seems to be better than the actual respirator. So we invented this. I did this and applied for a patent. And we got some awards for that, and we are looking for manufacturing and making a marketable product. And I'm glad I'm here. Dr. Vishay and myself work towards that, getting in touch with the bioengineering department. So I use the same high frequency nasal cannula. I don't want to go much deeper into it because to talk about high frequency nasal cannula is going to take 1 hour by itself. So I just want to introduce to you, I compared that, my device prototype here and the other devices that we use, and we used the test lung and we found that it's better. So, I'm going to skip this one. Actually, the data showed that my device is better than actual existing devices. And there's a way that my device can be applied to the babies in the delivery room when the babies are born, and in other places in the neonatal intensive care unit. So another innovation technique, connecting the unconnected. This seems to be the secret of Leonardo da Vinci. You know Leonardo da Vinci, right? He's supposed to be the genius 300, 400 years ago. Force connection between totally unrelated subjects. See, I have my device. I put my device here and I pick up some unrelated device and put it side by side. Just by putting two unrelated devices side by side, something triggers. The brain doesn't like two dissimilar things. Our brain, our mind does not like two dissimilar things. When you put two dissimilar things side by side, it has to make connection. And it makes connection. When you pick two different unconnected devices, it will make connection, it will bring some innovation to you. So this is another way of bringing, you have an object, you have a device, you want to improve that device, bring that device and put some random device beside it and leave it for a few days, and your brain starts working. And all of a sudden after 4 days you come up with a solution. You don't know how you came up. So this is another take-home message for you. This seems to be the remote connection. It's called remote connections, and that seems to be the basis of his genius thing. Another invention that I developed, pacifier pulse oximetry. You know, pacifier babies used to suck, right? I don't think Indian babies use that much, but in US and Western countries, almost all babies use that. You know, from the pacifier, people put the temperature probe. You can measure the baby's temperature when the baby sucks. So I said, okay, when they put the temperature, why can't I put pulse oximetry that measures the oxygen saturation? So we developed this simple concept, and we are doing a study on this one actually. Actually, what happens is when you put this pulse oximetry and allow the baby to suck, when the baby sucks, on the monitor, you will see a wave pattern of sucking. This is the first time we are visualizing baby's sucking ability. Very interesting, no one has done that. We're analyzing those wave patterns to see how mature the baby's sucking is. Now, again, this is a simple innovation and it's going to have a huge impact. Yale University from Howard, really they are interested, they're going to work on, they're helping me in collaboration. So again, collaboration works. Having just this device myself and keeping it myself is not going to work. I need to create an ecosystem, I need to bring the diversity to this, and then only it's going to come out to the market. Innovation technique number 3, take home. I'm going to hone it down one thing, use random words to come up with innovation to solve your problems. Here is the problem. The problem here, an example. Example is that when you have these milk cans, you need to maintain temperature in the shop, in the malls. And sometimes the temperature goes down, electricity goes off. So you don't know which milk can is spoiled and which milk can is healthy. So that is the problem. Once you define the problem, you want to solve. How do you solve the problem? You go to the random word and just pick up one. And in this case, an example, they picked a word autumn. Autumn means fall season. And in the autumn, what happens? The moment you think about autumn, you think about change in color of the leaves. So the concept, the principle behind that autumn word is change in color. Pick that one, put the change in color label onto, triggers the idea of smart label. You put a smart label on the milk can, and if the temperature goes down, that milk can label changes the color. It tells that, oh, my temperature, I was exposed to high temperature for a long time. Very simple thing. This is the same concept being used for vaccinations. If you're not storing vaccination in the right temperature, there is a smart label triggers and changes the color to red, and you say have to dispose it off that color. So simple innovations, major impact on the population. This is another innovation that I developed. Endotracheal tube, and you put a light at the end of the stylight when you do intubations, and this one is available. Again, this is just because someone already did it, you don't have to stop working on it. You just have to improve the existing product. That's how the innovation is. Someone did some product, you just improve on that product, twist it. You don't have to patent it, market it, you're off to the road. So another way of doing, you don't have to wait for a patent and spend the money on that one. So this is what we did, and again, this is going to take a lot of time. I'm going to skip on that one. This James Watt, who created the steam engine. Nature has a lot of processors. Keep an eye on the nature. And the nature, what the nature was doing was, he's a fond of steam, and he saw the steam pot steaming out, and that triggered him an idea that steam engine. It's revolutionized. Simple concept idea that came to his mind, revolutionized. So I think you had to allow yourself to be creative, and you'll be amazed. This is another innovation, my innovation that I'm working on. We're trying to make this portable radiant warmer, that's what we call. On this warmer, usually babies, we keep the babies, take care of the babies. We're trying to do this portable infant warmer that you can use in villages, home deliveries, that we can wheel it down and do it. simple creative idea. Look at this one. And then you have a neonatal intensive care unit, and you have a when your baby cries for your wife, your creativity is all you got. And this is the dad. And this dad, he made a mom's face, and how he did it, he put a hanger and a rubber band. And the beauty part of it is you can see the baby's intent eye to the mother. It works. It's simple, and it's you don't have to market it, and it gives a satisfaction that it's working. It's fun. What happens is once you do these kind of silly innovations, it triggers you. It takes you to a different level, and so that is the message I'll keep giving it to you. Another thing. A lot of people, I don't know if you know or not, the skin will oxygenate through the skin. Oxygen goes into the skin and carbonate. It's like lungs. Skin is like a lung, but no one has proved it. I said, well, I'm going to prove that one with my whole hand. So I took my hand, I put a plastic glove, and this thumb was not covered. I made a oxygen saturation, 96%. And I constricted my hand, I made a dusty bluish discoloration. Oxygen saturation went down to 83%, and that pumped oxygen into my hand, saturation 97. So this is a simple proof that I showed to the people. I showed to the Philadelphia guy who is working on dermatology optical densities. He said, wow, no one has shown that as a simple, and he said, he said it has a fantastic application. The baby's skin is so thin, it oxygenates very well. So this simple concept has a fantastic, you can create a device that apply local oxygenation to the legs, diabetic foot, you can oxygenate them. So there's a lot of applications to it. So you need to be coming up with go silly. So this is another technique. How many people see an old or young lady? How many people see old lady? Raise your hand. Okay, how many people see young lady? That is interesting. A lot of people see young lady. You guys are young, so you know where to focus. That is true, because I gave this image to my friend. She's a senior citizen. She saw the old lady, and it took 5 minutes for her to find the young lady. See, the message is that when you have a problem, you look at the problem for a long time in a different angle. If you shift the perspective, when you keep focusing on the problem and look for a different perspective, amazingly something suddenly comes up. So that's how you realize, aha, I see that, people say. So after when you spend a long time. Here you can see the rabbit. This is a rabbit mouth and eye, and rabbit tail, ears. On the opposite side is duck. Can you see that? If you don't see it, keep looking at it. Take a picture, but keep looking at it, you will find. That's how you solve the problem. And you see the flower vase here, right? Do you see the young lady? See, once you can shift the perspective by looking at a different angle. So that's the one way of, this is a simple innovation technique. Change the perspective. When you do that, you will get the beautiful ideas coming out of that. So, random object, I told you. You have a device, pick some other device on side by side, and it will trigger new ideas. This is another new protein that I'm working on. And this is another random connecting the unconnected that I'm doing. I'm bringing 3 different drugs, totally unrelated drugs, and I'm mixing them. And my university says, wow, we never seen this. We need to patent and protect it because this is fantastic. So I'm going to Utah University Animal Lab. Actually, I did a 1 animal proof of concept study, and it works. And the combination of surfactant, I'm not going to go detail into this PFC liquid and fibrin protein combination is, I know this is, do you see the lungs here? These are the lungs filled with the fluid. This is, I'm not going to go, I think I don't have time to go detail into it, it takes a long time, but what I'm saying is that I did exactly what it is, connecting the unconnected and applied for a patent. Think unpredictably. That is another thing. You need to learn the technique. These techniques can be learned. You don't have to be smart or genius to do that. You just have to practice, focus, one skill at a time and do it. And this is the thinking unpredictably. So what happens is we are very predictable. We love to be predictive. We want to know how the traffic is. We want to know how the weather is. What's going to happen after 5 days? Rain is going to stop or not. We are very predictable people. And if you give 2 pieces, we make a square, and if we give another piece, we make a rectangle, because this is a predictable thinking. So you have to be very unpredictable. If you give an extra 2 pieces, you do 3D image. So very unpredictable. Some people say this is divine inspiration. If you think unpredictably, it's a divine inspiration that you need to cultivate this habit. This is the problem. You do research and the development community join, you do your research and technology transition bridge. This is where I'm stuck. I'm at many places. It's a valley of death. It's innovators' valley of death it's called. Why? Because a lot of people go there and the innovations die here. And the innovations die here. I was there and I think I'm coming out of that. And because from here, innovation transition, you need to go to the vendors. You need to bring your innovation idea to the market. The gap is pretty bad. A lot of innovators die there. This is an example. This is the lessons to be learned here. My invention, 10 years ago or 12 years ago, I did an invention. It's called suckling nebulizer. This is US patent number, and this is my name here. And what happened was after 10 years, I didn't know how to market this. And I just left it because it was a good. I'm an inventor. I had a patent, and it's good for resume. Give me promotions. I did some scholarly activity. I became associate professor. So that was the end of it. But what happened was once my patent expired, the next day the company picked up this, and some third company, unknown company, picked up that because my patent expired, and they started marketing it. And you can see they're selling it for $100 a piece now. Yeah, they're $104 a piece. So I lost my patent because I had no idea of marketing. So you have to really have the ecosystem. I didn't have an ecosystem. I lost it. It's gone. But I felt good. As an inventor, I felt good. Well, my idea works. It's not a stupid idea. People took it, marketed it, they're selling it, and it's a great satisfaction. So I didn't feel bad that it's gone, but I think so again, same thing. Bring 2 dissimilar ideas, 2 dissimilar objects, 2 dissimilar, put them side to side together. The mind experiences instinctive desire to make connection between 2. This is use our mind weakness. Mind will not like 2 dissimilar subjects to be together. And it will make sure that some people say this is another technique. Bring a very interesting object, put them in a basket in your bedroom or study room. And if you have a problem, pick a random object and use that object's function, principle, and the idea behind that, and apply it to your problem. You'll be amazed how you solve. Connecting the unconnected, thinking unpredictably, it does work. This is another, I'm trying to work on heart murmurs, visualizing heart murmur. No one has done that, visualizing heart murmur. Random words, again, if you go to random word generator, it will tell you how to do the force connection between the problems. So this is what I'm going to do. So I always believe these babies are smart. You can see 12 hours of labor. I'm going to hear about this for the rest of my life. So I think the babies I don't think they think like that. I think, when the babies are 12 hours of labor, they really end up having a problem. When you have a problematic baby, this is my another 6th invention. We created a simple head stabilizer. And how we put inside a hanger wire, and we put a sand so that you can stabilize the head. Head doesn't move, and it should not hurt because the skin is very sensitive part. So I hope you're not sleeping. I hope you're having a good time. If you want the maintenance dose of coffee, please go ahead and go and get it. I don't mind if you move around. but I think there's a lot to be talked about. I don't know if you have another 15-20 minutes, is that okay? So I will speed it up and see how we can do it. So this is another iPhone app. Like I know I have plenty of apps I developed, and this will be another app to run the codes. How do you run the resuscitation? How to revive the babies? That has to come in an iPad. It's a visual representation of that I'm working on. We'll be doing simulation studies. And yeah, these babies are very creative. These toddlers are very creative. Talk to them. Be serious. Take seriously. Their fun activities are very creative. Take seriously and use them. And that is one of the important messages I'm telling you. And another technique is, if you have a problem, if you have a device problem, go to the stranger. This is another technique. If you have a medical problem, go to a completely non-medical person and ask them, genuinely ask them, seriously, how do you solve this problem? You will be amazed how the solution comes. This is a random way, chaotic way, unpredictable way of getting ideas. It works. So we created a neonatal restoring device, another simple way of restricting the babies so that we can do the procedures on the babies. And actually this came to Las Vegas. We just this year we finally one company picked it up and we're going to market it soon. So that connecting the unconnected. I told you many examples now. This is another lessons to be learned. I lost this invention too. I know what happens is this device, when you jam the infrared light on the skin, it measures the jaundice level. Anybody know this? Billy check. Where I see the two hands there. Pediatrician, you two? Are you guys a pediatrician?
No, biomed.
Biomed, yeah, you know that. So this is a very simple device. You jam that light laser and it measures. It's a beautiful concept. It measures the optical density of the skin. Epidermis, dermis, bilirubin, all those things, subtraction. When I read this concept behind the mechanism, behind the machine, I said, wow, I can measure the optical density of the skin of a premature baby. When you measure the premature babies, you can tell the gestation. How many weeks that baby is? Is it 30 weeks, 35 weeks? So that was, I talked to one bioengineer in Colorado, in the USA, and he took that idea. He didn't talk to me after 6 months. Next time I talked to him, he applied for a patent in Brazil. He applied a patent in Brazil. He thought, this is, and then he stopped communicating. I said, fine, if you want to do that, that's okay. I'm happy that at least my idea works. My idea is a work, and it's going to change it's going to solve people's problem. I think you get that satisfaction. I'm going to skip another invention that I did. Yeah, these are all my inventions. I'm going to skip this one. So let me reset the button. And so, and then go to my research. You must have heard baby when they're born or before they're born, they have this umbilical cord that goes around the neck. We call that nuchal cord. And sometimes it's so tight. It's so tight, babies die. And it's called nuchal cord. And then I compared this nuchal, you can see this. This is the pathology specimen, almost decapitating, it's so tight. And then these babies die. And you can see multiple cords here. I'm comparing this for the first time with this adult strangulation. This is pathophysiology is nothing but adult strangulation. And I'm trying to come up with a new syndrome, and no one has done. You can see when you're strangulated, you have duskiness surface, petechiae, and then facial duskiness, bruises, subconjunctival hemorrhages. This is nothing but strangulation. No one has compared babies' umbilical cord around the neck to this strangulation. And so that's one side of the story, and this is my business part of the creativity work. I've published iPhone app, like I was told. These are my 5 iPhone apps. This is a heart condition. I created a board exam, multiple choice questions for the neonatologist. So they say, and we created the neonatology on wheels. These are the plastic sheet wheels that you can keep it at the bedside as a clinician and look at them and apply and create an. So I'm going to skip this one. This is a simple another research project. This is mdpocket.com. It's selling my laminated products. So this is the medical side of my story. So the non-medical, I really felt like this baby that I've been cloned because I published my poetry book too. And this is in Amazon.com. If you go there, if you have any poetry poet here, medical poet here, well, you will become, if you are interested in it and work at it. And I published 2 books, and they are all multiple choice questions. And these are the author for this is Dr. Silverstein from Connecticut, and he's a physician, he's a pediatrician, he's a humorist, he's a comedian, he's a doctor, physician, humorist. So if you read my books here, there are a lot of jokes, a lot of mnemonics, how to remember these tough subjects. So that there's a fun way of reading the books. Finally, nature has a lot of big concepts. Nature has, we need to be looking at those processes and thinking about it. So that's about it, and that's the end of the story. Thank you for your time.
Process will start from here, so you don't have to run. So you have 10 minutes extra. I forgot to acknowledge, the IIT students who are here. Thanks to you guys for coming to our campus on and off, for all the activities, and some of you are real inspiration for some of the students. Although we talk only for 5-10 minutes, especially your faculty when they come here, we discuss on small subjects. Thank you so much for coming from the Center for Healthcare and Entrepreneurship, I guess, right? Thank you so much. As sir told, the innovation, it need not be very expensive. Sometimes when you are really intelligent, your seniors cannot acknowledge that. So go to the next level.
Yeah, just remember, be foolish and be silly. And keep it to yourself. Nobody likes. See, the word judgment has a lot of connotations. People judge you. The moment you say some ideas, they judge you. Oh, it's not going to work. It's already done. Somebody did. Don't go to them. Don't listen to them. Trust yourself. Believe in yourself. Keep working it, and you will see the amazing growth in that. So that's the message for you. If people judge you, there are a lot of people who encourages you. Go to them. Or the worst person who judges. Guess who is the worst person who judges on you? Anybody know? The worst person who judges is you. You judge yourself. Oh, I'm not that good. I'm not good. My idea is not good. So don't do that. I hope you guys got some important lessons to take home. Keep them and enjoy.
Now I request our VC sir to come into the dais and give a small memento as a token of gift from our side. And I also request other faculty members, principals,